Good afternoon, everybody. I want to welcome you to the Mayor's Commission for Citizens with Disabilities for the City of Omaha, Nebraska meeting for the month of April 2023. I want to welcome our television audience, any guests, our members, and our interpreter. Um, I do want to mention that we have managed to get rebroadcasts of these meetings. They're broadcasting it live on Channel 22. You might be seeing that, but you also might be seeing this on rebroadcast. And it's saying 7 o'clock on Tuesdays, but I've seen it at 5 o'clock on Mondays. At days I happen to be in front of a TV at 5 o'clock on a Monday. But as a reminder, videos of this meeting can also be viewed on our Disability Commission website at www.cityofomaha, that's one word.org. Click on the mayor's office and then click on the Disability Commission, and that will take you there. Very briefly, I want to just talk a little bit about our mission, purpose, and then get into our meeting format. Um, our main objectives as a commission are to promote the quality of life, accessibility, and equity in all aspects related to the City of Omaha on behalf of and in cooperation with citizens of Omaha who experience disabilities. To this end, the Commission advises the Mayor, City Council, City Department heads, and other personnel on issues of access, representation, employment, housing, quality of life, as it affects citizens with disabilities and their respective families. We look to serve as a resource for people with disabilities in Omaha and their families in terms of their concerns and helping them resolve issues that affect them. We try to work to publicize to all citizens of the city the role of the Mayor's Commission and the resources available to assist citizens with disabilities, employers, housing representatives, business owners, engineers, architects, pretty much anybody who might have a role in bettering the life of Omaha citizens, and particularly those with disabilities. We work to promote awareness to the general public on the capabilities, needs, and desires of people with disabilities. We try to occasionally, once in a long while, publicly recognize the efforts of employers, businesses, schools, organizations, and others who've demonstrated outstanding support in terms of programs and services for citizens with disabilities. We look to advocate on particular issues and implement plans and projects to improve services. And we review and implement plans and projects for advocating for persons with disabilities. A couple of examples involve our discussions with the folks that put together our brand new mall downtown, as well as some of our conversations with the local public public transport operators, Metro Area Transit. So, given that, a couple of quick updates. The format of our meetings, we had a pre-meeting where we discussed a number of topics. We have 7 new members, so we're working to get our new members kind of onboarded and up to speed with how we do our work and what some of the possibilities are in terms of how we might go forward with our work. The main thing that we talked about, at least at this juncture, was given that we have different representatives of any kind of issue related to disabilities you might think of, we talked about who we might be bringing in for the rest of this year. We had some of our new members are present and online, so we were able to kind of get into that discussion a little bit, and so we're just making some plans on who we might be able to bring in to inform the citizens of Omaha on disability issues that are really important to those with disabilities. Um, we did, let's see, a couple things. Have a paper and pen handy to take notes. We'll try and do some announcements at the end of the meeting. Um, uh, we did not have a quorum today. Um, uh, because of state law, uh, members of the commission have to be present, physically present, for a quorum to be to reach quorum. And actually, most of our members are online, so just it takes me back to a time that I'm trying to put out of my mind related to some pandemic. Um, so we weren't able to approve our minutes or our agenda for this coming discussion. But as I say, we'll take a second at the end to have folks introduce themselves and mention any topics in terms of the members of the commission that might be a big issue coming up. Like in May, there's going to be another repeat of that festival out in Northwest Omaha. Yeah. So, so at this point, I want to recognize and introduce Tamara Dwyer. She's with the city. Um, she's the Homeless Services Coordinator. If I hope I got that right, Tamara.
Yes.
So,
you did.
And she'll be talking to us about homeless issues as it relates to people with disabilities. One thing that we found in some of the demographics of disability in Omaha and other cities is that people with disabilities tend to be overrepresented in our homeless population. And so we thought it'd be great to have Tamara talk more about what she does in that area. If you have slides, we can accommodate, but Kat needs to run over quickly and help you get that figured out.
Yes, I do.
You got it?
And I did send them to her, so.
I'm just talking about how it usually goes, Tamara.
Yeah.
So.
Okay.
Great, perfect, thank you.
So, hello, thank you. Thank you everyone for inviting me. I'm very honored to be here and let you know about my position, what I've been doing with the city of Omaha over the last few months. I can introduce myself a little bit, let you know a little about myself before we get started. My name is Tamara Dwyer, as you had mentioned. I work as the city's homeless services coordinator in the mayor's office, and I have been working in homeless services here in Omaha for about 10 years now. I started with Youth Emergency Services, doing street outreach. I've worked for Stevens Center.
But apparently you're very loud.
Oh, sorry. I've also worked at Stevens Center in their shelter, permanent supportive housing, and recently, before I came to the city, I was working at the Continuum of Care, MATCH, also known as MATCH, the Metro Area Continuum of Care for the Homeless, within their coordinated entry and housing problem solving programs. I have lots of knowledge and resources about local homeless services work in as well as national initiatives and national best practices. I'm a master level social worker, provisionally licensed therapist, and all that stuff as well. So I will get started with my presentation here. Here we go. So I wanted to just start off by letting you all know I started in December of 2022. So up over the last few months up until today, I've met with several community organizations, over 50 different community organizations to some capacity, getting some input about how they see homeless services currently working here in Omaha, or what I can do to partner with them or support the work that they do. I've met with all the different city departments, a few state and county agencies or in groups, many different advocacy groups, and a few national partners to help further the work that I'm doing. I have developed a few priorities to focus on with the mayor, including getting her homeless task force together to set some goals around homeless services, broadening their scope a little bit, some longer term planning, leading and developing a city process for responding to encampments or unhoused community members, so making that process more streamlined and better for all members of the community. Strengthening the collaboration between the City of Omaha and the collaborative street outreach teams, providing some training and educational opportunities for different groups, businesses, or individuals in the community that just want some resources and education around homeless services. We also have a focus on ending veteran homelessness, and I've been involved in that work in our Omaha for about 3 or 4 years now. So just continuing on that work that has been done and supporting the local VA and our different partners that are providing veteran services to veterans that are experiencing homelessness, just helping them further along so they can officially declare ending veteran homelessness in Omaha. We are very close to that. Creating a plan for a community response to emergency relocation that leaves community members without a home, such as what happened with Legacy Crossing. So you have a lot of people without a home for circumstances out of their control. If we can get community members and city departments together to create a plan that's kind of there when something like that happens. All right, and I'm going to show you some data for our community. And just to let you know, when we look at data in our community, it includes Douglas County, Sarpy County, and Potawatomi County, because that's what HUD considers our continuum of care. And it's really important to look at the broader scope of those 3 counties or the continuum because this particular data, the point in time, and the housing inventory chart, those data sets go to HUD to report to Congress to decide funding for a community, and it isn't broken down into just Omaha or, Council Bluffs. It's always all together for our community. So for 2022, our total was 1346 for one night in January or one day in January experiencing homelessness. So we can expect that might be like on any given day in a year that 1,346 folks in Omaha are experiencing homelessness. It went up from the previous year, as you can tell. And we had 175 folks in transitional housing programs. 161 were unsheltered, which has went up every year for the past few years. And we had 1,010 folks in emergency shelter. And we had 0 in a safe haven situation. And that is mainly because we don't have any safe haven beds anymore. So that would be why there is no one in that kind of program.
Sorry, Tamara, I usually don't interrupt
Yeah,
before,
no,
but
you're fine.
could you go back on
Yeah.
the slide and, for at least for my benefit, can you define those different categories of housing for us?
Yes, absolutely. So transitional housing is a program that is time limited, usually anywhere from 6 months to 24 months, and there is a component to it that is like they might have to participate in treatment. They might have to they have a certain kind of program agreement, rules, whatnot to participate in for transitional housing. And the idea is that transitional housing helps them become more stable into permanent housing. So they will transition into permanent housing from that transitional housing program. Unsheltered, it would be folks that are residing on the streets, in their car, or any other place that is not meant for human habitation. And then emergency shelter would be any of our any of our homeless shelters that are in the community, Sienna, Open Door, Stevens Center. And then a safe haven is a very specific program that is geared towards people who have mental illness that exacerbated mental illness. I don't know how you want to put that term. They have severe and persistent mental illness that, and they also are resistant to housing, or they might not be quite wanting to be in housing. So it's not necessarily a program of sorts. They can maybe come and go, but it's very specifically geared towards people with severe and persistent mental illness. Okay. Along with some of the many different data points that HUD collects in their reporting, one also is their last permanent zip code. So when they're talking with someone, they would ask them what their last permanent zip code was. And I like to just highlight this so that people can see that a majority of folks in our community that are experiencing homelessness have a last permanent zip code that was within Omaha. There's a few, because Council Bluffs is included, that report a Council Bluffs zip code, and then some zip codes that are outside of the metro area other than Omaha, Council Bluffs, and then 9.3 were unanswered. Chronic homelessness is something that we have seen go up continuously through the years. And what chronic homelessness is someone who experiences homelessness for either 12 consecutive months, or they have 4 or more occurrences of homelessness in a 3-year time span that equal to 12 months or more. And in addition to that, they have a disabling condition. So those two, so it's a specific length of time and then a disabling condition that would define someone as chronically homeless. So in 2022, there was a total of 494 of those were unsheltered, and 306 were in emergency shelter. And I like to highlight veterans here, since we do have a focus on ending veteran homelessness. Our veteran population, as you can see, has went down over the last few years. 26 of those were in a transitional housing program last year, and 64 were in emergency shelter, and 1 was unsheltered. These are some subpopulations that are listed in the point-in-time count and data. And just know that these might be duplicated, as someone can experience domestic violence and substance use disorder. So it can be duplicated, or somebody might, check all 4 of those boxes. But we have we had seen 82 that reported they were fleeing domestic violence last year, 9 with HIV or AIDS, 576 reported to have a mental health diagnosis, and then 480 reported to suffer with substance use disorder, either currently or in the past, sometime in the past. Some additional point in time and housing inventory chart data. 12.3% were under the age of 18. 4.8% were Native American, and if you understand or know the kind of general population percentages, that's very high disparity for Native American within the homeless population. There has been a shelter bed decrease, a permanent housing bed decrease, which would be rapid rehousing, permanent supportive housing, or other permanent housing. Utilization of shelter beds is down also. And our young adult population, age 18 to 24, has decreased a little bit. And also remembering that this is a system, like I mentioned before, so we look at the whole system data and not an individual agency, program, or specific location. And I did include a couple extra slides for you all. So this comes from the Institute for Community Alliances System Dashboard. They are the data lead agency for the homeless services. So they have a dashboard, and this looks at the system performance measures fiscal year 2022. It's not point in time data. So this looks at total folks that were served in homeless services over a whole year's period, not just a snapshot of one day. And it could have been that they were served just one day out of the whole year or the whole entire year. So this just looks at everyone who touched the system. And the total number, I believe, was a little over 5,000 over the course of the year. And then of that, a little over 3,900 reported any disabling condition. And just like the subpopulations before, someone can select multiple disabling conditions. And this is all self-report unless they are getting into a specific type of program that requires more verification. But in general, this is all self-report. So we had a little over 1,600 reporting a physical disability of some kind, 598 a developmental disability, 1,400 a chronic health condition, and then 57 reported HIV or AIDS. 891 reported both alcohol and drug use, and then it also is separated out. 647 reported drug use disorder, and 525 reported alcohol use disorder, and 2,579 reported a mental health condition. And then just wanted to highlight Housing First for all of you. So Housing First is a model that HUD urges all continuums to use, but it's best practice. There's lots of research behind it. I have some documents I was going to provide to Kat to share with all of you afterwards. So it is housing first, but not housing only. So we have to remember that we are hoping within a housing first program that we're connecting somebody to housing first, but also continued supportive services that they want and need. It must include voluntary supportive services that are person-centered, a high value of the importance of human relationships. So if somebody is not wanting anything or, still working on engaging them and having a connection with that relationship. It's based on the quality of services and not necessarily the quantity of services. It works best with harm reduction practices. Having a knowledge of fair housing regulations is important for any Housing First program, and it should work to prevent eviction as much as possible for the person. And it requires collaboration across all levels of involvement within different programs, organizations, systems, and government, and also those experiencing homelessness. And then these are just some resources that I will share with you you'll have this slideshow for yourself, and you can check out the different resources. There's some dashboards there, and then some national organizations that have a lot of great information around homeless services, any kind of specific thing that you're wondering about. And I can also answer questions for you too. All right.
Thanks, Tamara.
Yes.
Questions?
What does the HIC stand for and the point in time HIC?
Oh, sorry. I'm so sorry. I had another presentation that I kind of spelled out, and I forgot to put that in here. But it's the housing inventory chart, and they're submitted together to HUD, the point in time count and the housing inventory chart. So what it looks at is the point in time count looks at everyone in the community that's experiencing homelessness, And then the housing inventory chart looks at all of the beds, the utilization of the beds, including shelter, transitional housing, rapid rehousing, permanent supportive housing, all of those things. Now, rapid rehousing and permanent supportive housing wouldn't necessarily be on the point in time count because those people will hopefully would be in housing, so they wouldn't be homeless anymore, but they kind of show an overview of like what's available in the community on the housing inventory chart.
Okay, thank you.
Yeah.
That was wonderful information, most of which I unfortunately didn't know or didn't know of. So I really appreciate
Yeah.
you kind of laying some of that out. I have a few questions, so I'll try to
It's okay.
take them one at a time. So as you were looking at all those numbers and kind of developing the different collaborations,
Mm-hmm.
and you see how many people that are experiencing homelessness are also experiencing different types of disability.
Mm-hmm.
And knowing that nationally only 6% of housing is considered accessible.
Yes.
Can you speak to anything that you're talking about or collaborations that are working to address the affordable and accessible component of the housing crisis?
Yeah. Well, there's many different areas that have started that conversation. I've been involved in conversations about affordable housing and also accessible housing. One of the things that I know just from working with people that are experiencing homelessness or working with case managers that are assisting folks into getting into housing from experiencing homelessness is that oftentimes it's hard to find housing because it is not accessible and people aren't able to get to the units that are available, aren't able to access the units that are available, so it just extends their homelessness longer. Some of the conversations I've had with some national organizations, just how to start those conversations, where to start those conversations with different groups. And also our planning department has been great here with different funds like the home ARP funds or, what they have control of with being able to prioritize those kinds of projects that are more accessible to folks.
Awesome. Do you, you had mentioned at the beginning of the presentation, since you came on, some of the kind of initiatives that you've all been talking about. So for the, talking about looking at updating processes to responding to encampments or situations where there's, I can't remember how it was phrased.
Unsheltered homelessness.
Unsheltered,
Folks that are staying outside.
Yes. And then talking about some of the trainings, and have you gotten enough into those conversations to share anything about kind of what is being looked at or kind of what might be able to be expected for the community and for the community organizations that are working on this too?
Well, I haven't gotten far into community conversations with different community members. I've started to talk with a few different neighborhood associations that have asked, how can we best interact with folks experiencing homelessness? How can we make our neighborhood better, for us and for people experiencing homelessness, and have kind of presented what the data looks like currently, and then just talked through their questions about interacting with folks. I've worked with the Old Market Association to develop kind of a streamlined, if they are concerned with someone, what do they do? What are the kinds of things that maybe they can connect someone with me and I can get them connected with street outreach, or if there's something else going on, what other options are there? Just it's very nuanced and complex, each individual person's experience in homelessness. So it's not like a one size fits all solution or answer, unfortunately, you know. So I definitely have started having those conversations in the community and within the city, different processes. I've worked with all of the different departments to start streamlining things to me so that I can get people connected to street outreach and hopefully continue their work towards housing. And all of the different city departments have been nothing but great and supportive. So I've nothing, they definitely have been encouraging and working with me as much as they can. So
Awesome. Thank you for that. Last question from me at this time. Can you explain a little bit what street outreach is and what the responsibilities are and what role they kind of fill in the process?
yeah, street outreach can look different in each organization. So generally speaking, street outreach, would be the team of staff that connect and provide basic necessities and provide housing plans to folks that are living street homeless. They're either in an encampment or they're just unsheltered, staying somewhere, living in their car, or a place not meant for human habitation. Now, some programs might have different focus, so maybe some might be more basic needs focused and some might be more housing focused, but the outreach team that I typically work with is the Continuum's collaborative outreach. So you have various different programs. So, for example, their Youth Emergency Services has street outreach, right? So if I get connected to a youth that is experiencing homelessness, I would work with them and they would kind of determine, if they need to meet their basic needs or if they can start working towards housing with this person, maybe trying to work through barriers to get them either into shelter quicker or get them into housing quicker, whatever that looks like. And if that person isn't open to that right now, really the role of street outreach is to build the relationship and trust with that person so that they can get to that point.
Thank you.
One of the things, Tamara, that I picked up early in your discussion, well, I have two questions. I'm not sure which is the harder one. I'm trying to answer the easier one first. I'm not sure if I'm going to accomplish that, but you talked about the fact that there are no longer safe haven beds available for folks that have comorbidity with mental illness as well as their homeless condition. And I was wondering what led to that and how that needs to be addressed, because certainly I don't see that being something that we would want to ignore.
Right. No, I definitely agree. I'm not for sure why. I do know that the only safe haven beds that we had in our community were funded by the VA. So there could be some reasonings. I'd have to ask them for sure why we don't have those beds anymore. But in general, I mean, I would hopefully like to see that if we're taking beds away, right, so some kind of emergency shelter beds, it's only hoping to increase our housing support. So, did we get programs that increased supportive services for people in housing or rent assistance or, that kind of thing for people in housing? I'd have to talk to the VA for specifics because they had the safe haven beds in the community, but that's kind of what I would hope for. I know we didn't have a lot in general. We just had a handful.
Would seem to be something pretty critical, noting that, I mean, as you head around the city and you see folks that are clearly not sheltered, and the number of folks that are exhibiting, at least indicators that might lead one to believe they have some kind of mental disturbance. But kind of a second broader question, though, is you've been on board for a few months now, and you clearly have lots of experience. I'm really familiar most with Stevens, although
Yeah.
Open Door and some of the other programs we've actually had come present here. Um, and so what would you say, I mean, we're hearing a lot about your activities in terms of coordinating
Hmm.
and working with different groups that cross over this area of concern. But what's kind of your maybe positional um, objectives?
For like focus on my role in general. So like
Yeah.
so kind of what I listed on that second slide, um, creating the goal or strategic planning, I guess you could say, with the homeless task force. Light strategic planning. It's not like a terribly large group that, would be very big, but having some clear goals and objectives for that group, and working with the community partners that are currently hoping to reach veteran functional zero. That will require some organization and structure around what needs to be reported to the federal government, data wise and outcome wise, to be able to declare that. So that, of course, is something that's on my list. And the process for the city's response to encampments, in collaboration with street outreach, that takes probably most of my time, because it's very specific to each person, each situation, each organization. I would say that takes the bulk of my time right now until it's further developed. I've also, for that particular piece, been working with the county GIS system to develop an internal tracking map, so that we can collaborate better as a city within the departments on what's going on with maybe locations that have multiple unsheltered people. How can we serve them better by collaborating and being able to know what's going on with other departments with any specific location.
That's super helpful. I was kind of circling back to your very early comment about the trend.
Yeah.
In terms of the number of unsheltered individuals
Mm-hmm.
is not decreasing.
No, and they
So,
do expect, they did the 2023 point in time count at the end of January, and they do every year. And that was submitted at the end of March to HUD. All of the data from that was submitted at the end of March. And I haven't heard if they have any finalized numbers or anything. They have to wait to be able to make those public until HUD verifies and things. But they do expect for the unsheltered number to go up from that 161 this year.
okay, thank you. Others with questions?
Well, I actually have a couple you may not be able to answer, but going back to, we're talking about the homelessness. I recently retired from working with the state, working with blind and visually impaired and deafblind individuals. And aside from the vocational rehabilitation piece, we worked with people in an independent living track or older blind, as well as working closely with blind or disabled veterans.
Mm-hmm.
And I know I just continue to work with them to try to keep from going into homelessness, and helping them connect with Medicaid and all other, health and human services. But affordable housing is a big issue in
Yeah.
the city. You look around at all of the building that's going on, but where is the emphasis on keeping it affordable for people to be able to sustain their homes? And the part of that is keeping that inner city that we're building up so much, because that's where the transportation is available to people who have disabilities.
Mm-hmm.
I know there's new efforts to expand some options with metro area transit, but the reality is, going so far west, that's not changing in the immediate future.
Yeah, no, and I mean, most people already have their established communities, right, in areas that are further east. So we don't want to make people move outside of their support network, you know, because they can't afford to, or they can't find affordable housing. I think on the city side of things, of course, the mayor working with Front Porch Investments to increase affordable housing with the 20 million from ARPA, and they're going through the process with Front Porch to kind of to help increase the affordable housing. I think that speaks to the importance the city sees as as knowing that affordable housing is a real issue here in Omaha, and that we need to take steps to make more affordable housing for everyone, and not just affordable housing, but give people more options, right? Because that's somebody might only have one option and it's somewhere where they don't want to live. People should have more options for housing, and that includes increasing affordable housing and accessible housing.
And so my second question is the part that maybe you can't answer, but
okay.
in working really closely, I worked with our agency for a little over 40 years. And in that time, this last couple years, having to work with so many individuals that are experiencing blindness and homelessness, and they were couch surfing because they had to wait for the waiting list, to be able to have access. And so in trying to do advocacy, talking to, which is almost impossible to talk to somebody at the housing authority or some of the resources, they would have in a building 8 open apartments, and the person might be number 4 on the list, but they had to get to number 2 on the list before they would be considered, which doesn't make sense to me when there's 8 vacant apartments,
Yeah.
So I'm just not and I'm not sure that I really understand that process. I understand that people that are making application might be homeless, and so there's a whole process of trying to connect to them to let them know that there is availability for housing. But if you're number 4 on the list and there's 8 apartments, I guess I just don't understand.
Yeah.
And that might be something you can't answer.
Yeah, well, it definitely isn't something that I can answer specifically. Each of our public housing authorities here in the Omaha area, we have Douglas County Housing Authority, we have Omaha Housing Authority. In their jurisdiction, they have some flexibility under HUD, to define some things about their application process, preferences, priorities, so it kind of would depend on what those are for that specific housing authority that you're referring to. I would advise probably the best option would be to engage with that housing authority board, and see if they can answer those specific questions.
Okay, I did try that. Thank you so much.
Yes, hi. I also have a few questions. First of all, I work for the Commission for the Deaf and Hard of Hearing. Sorry, not so much blind, deaf and hard of hearing. We also often have that same issue that comes up. So I want to ask you if you could explain for housing for people who are deaf or hard of hearing, how does that affect that population?
For housing, I mean,
yeah, for fair housing.
For fair housing, really, if you're thinking of fair housing for anyone with any kind of disabling condition, I mean, they can't really, if someone needs a reasonable accommodation or whatnot for a disabling condition, it doesn't really get specific as the kind. They can't really ask what the disability is. So I guess I don't know if I'm answering your question right, but maybe I need more clarification.
Yes, okay, that's fine. I can ask another one or another way. Myself and the commission, we do have some issues with HUD and asking for maybe flashing lights or alarms in the home, what you might call accessible at specific times, and then the landlord may say, oh no, we don't have to provide that, or sometimes they say no, but we'll do it, but the individual has to pay for it or pay us to install those kind of accommodations that are necessary. And this is something that we frequently confront.
So that's probably where it falls under the gray area, of course, of a person can request a reasonable accommodation, right? If they need that to be able to enjoy their home and live in their home, access their home. There is a caveat to that says if it is not a cost burden on the property owner, the property manager. If it is a cost burden, then they can ask the tenant. They can do it if they pay for it. I think if you have a specific situation, I mean, the Fair Housing Agency, I don't know if you all have met with Joe Garcia from Fair Housing. He might be able to answer those specific questions for that. I think it would depend on what the accommodation is, how much it costs, on how they determine if it's reasonable.
Well, and I think you just, with that last statement, hit on the support in that defining affordable. We run into it with businesses, and it's very ambiguous.
Yes.
And subjective based on who's assessing that request.
Right.
Right, yes, I agree. And so that's one client just recently said the landlord told them that the person would have to pay to install the fire alarm, and it was $200. And so that's what I was thinking.
Yeah.
How is that affordable or not affordable?
I would say if the landlord says that, definitely consult with Fair Housing to see, because of course they might say that, right, if they don't know, but I would consult with Fair Housing to make sure that if it's outside of the realm of reasonable or not.
Yeah, we have had Joe
Yeah,
talk to us.
he's great. Yeah.
Go to the source.
Right. Okay, and so I had one more question. I wanted to know the reason that a person without a home, why do they call them unsheltered? Because if they have, what is preventing them to receive some kind of sheltered housing?
Well, there could be lots of so sheltered would be an emergency shelter or a transitional housing program. There could be lots of reasons, including accessibility.
I'm sorry, say that again.
There could be lots of different reasons, including accessibility and want of the person, right? Within Housing First, practices, we want it to be person-centered and driven by what that person wants and needs. So not just, someone else's objective opinion looking in, but also what they want. But then a lot of times it has to do with accessibility. Maybe they have a pet and they can't bring their pet into shelter for whatever reason. There's lots of layers behind that we've had lots of conversations with Fair Housing about, and there might be that there's only top bunks left, right? And a person can't get on the top bunk for whatever reason, right? So they can't get into shelter or various other things. Maybe it's too stimulating for them to be in that environment, in that congregate environment. But it's very unique to each person's situation. I would say if they say that they can't access shelter, they have a legitimate reason why.
I have a lot more questions, but okay. We'll table it for now.
Somebody online.
Yeah, Andre, did you have a question?
Actually, I have two questions about what she presented. So I'm gonna throw up this is kind of weird. In any case, I have two questions. The first one is, I remember you talking about how essentially about 4.6% of the homeless population in Omaha and in Nebraska is about 4.6.
4.6 is Native American that experiences homelessness in Omaha, not across Nebraska, but just in Omaha.
But what are statistics for other ethnic groups in Omaha in terms of the homelessness population? Like, what is the homeless population demographic for Black people who are homeless?
Yeah,
And
I don't know those off the top of my head. Maybe I should start memorizing them now. But for 2022, that I have a dashboard I can highlight for Kat when I send some follow up information that kind of goes through the racial disparities within the COC and get that to you all to review.
all right. And the second question is, like, hypothetically speaking, if there's a actual person who is homeless in Omaha with say schizophrenia or any kind of other mental disorder that could be problematic for them living in outside in the elements and stuff. Do shelters in Omaha have the means to actually provide them with the proper medication for all that, like antipsychotics?
So some shelters might be able to connect them to those services, but shelters wouldn't necessarily automatically have those, a doctor to prescribe the medicine and get the medicine to them or have the medicine readily available there. I wish we did. In a perfect world, but we definitely they can connect them to the right resources if the person is willing, and go from there. But they wouldn't have them necessarily on hand at the shelter.
Oh, and on a side note, do they have like, so they have to be referred? So, do they have to pay for that, or do they get that for free? Because homeless population, I'm pretty sure they can't afford it. So,
No, yeah, you're right. I mean, in most cases, actually, a high percentage of people who experience homelessness have some sort of income. Um, but there are folks that have a very low income or don't have income at all. A lot of street outreach workers, shelter case managers, and various people that serve folks that are experiencing homelessness work with them to get them signed up for things like Medicaid or get them into programs that serve low income individuals, like programs like Community Alliance, Heartland Family Service, or get them utilizing, if they already have Medicaid, get them connected to a provider that is taking Medicaid to help get them the care that they want and need.
okay, that sounds pretty good. I was just kind of wondering about that. Also, I'm
Yeah.
sorry if I interrupted somebody.
No, you're fine, Andre. No problem.
All right.
Others with questions for Tamara, online or otherwise? Okay, well, let me express our thanks for your coming here and sharing really great information, Tamara. Really
Yes, no
appreciate it.
problem. Like I said, it's complex. Homelessness touches every single system and every single person in our community, and um, we aren't going to be able to solve it unless everybody is able to collaborate because it's so complex and wide-reaching.
I would add that if there's some way that we can help support what you're doing, given that we have lots of experience across the all realms of disability, please don't hesitate.
Yes, absolutely. I definitely am even thinking of a few places that I could connect you all to have your insight, in regards to affordable housing. So I'll follow up on those.
Perfect, thank you.
Yeah.
Okay. Thank you, Tamara, for that really excellent report. We didn't really have any, I talked about business earlier as we were getting started. I do want to have folks go around and take a second to introduce themselves and kind of what the population or the individuals you're here to represent. And if you have any upcoming events or activities that you want to get out and make sure that folks are aware, I'll start. Since I'm talking, I'm Mark Smith. I'm a parent to and sibling to adults with intellectual and developmental disabilities. I work at the Monroe Meyer Institute, which is the University Center for Excellence in Developmental Disabilities for the state of Nebraska, and I serve as chair on this committee. I'm not quite sure how long, because we were talking about it earlier, and it's like, is it that long? But I'll leave that one alone after that comment. Megan?
I'm Megan Walls. My business is Assistology. I provide training and consultation around disability inclusion to businesses and a lot of other types of projects. So I kind of here to represent the greater disability community across age and disability type. I'm the vice chair for the commission. A couple things I wanted to share. Mark alluded to it earlier, but there is an event on May 20th from 4 to 8 p.m. called Progress Fest. It is being hosted by and held at Angel Guardians off of 156th and Spalding. It is at no cost to attend, and it's really to bring people in the community together to just really demonstrate community inclusion across different types of activities, and there'll be food trucks. And I think Down Syndrome Alliance and Angel Guardians are going to team up to put it on this year, so that will be really fun. There's usually music and different types of activities. Another thing that I wanted to make the community aware of that I just saw through some of my networks is that the Omaha Community Playhouse has launched a mobile sensory theater. And I had the pleasure of going down to see it in action this week, and because I really didn't know what it was or how the community could access it. But it is available for families who have an individual in their life with autism and has struggled to access community theater events. And they have created an interactive, immersive theater experience that goes to the family at no cost. They've done it at schools and stuff too, but it's really, really cool. And I think it might actually be at Progress Fest if you want to check it out. But you can go on to their website and you can reserve it to come over to the house for a birthday party or anything else. So that was really cool. And then if you or anyone in your life grows a mustache, Mustaches for Kids is going on next month. And normally it's not something that I would highlight, except that 3 of the 4 bonus charities receiving money from the event this year are all organizations who provide services or support individuals with disabilities. So Gotta Be Me, Angel Guardians, and Down Syndrome Alliance. So just a great way to show support and help raise some funds for those organizations.
Thanks, Megan. Nancy?
I'm Nancy Floral, and I just recently retired from the Nebraska Commission for the Blind and Visually Impaired, serving individuals blind, visually impaired, and deafblind, providing vocational rehabilitation services, independent living services, and services to older blind in order to retain their independence. So one of the upcoming events, I know that the agency will be having an employment conference in May, which will be held in Lincoln, and they will be holding in June an older blind conference, which will be in Kearney. I do want to, since Stephanie's not here, to talk about Outlook Nebraska. Outlook Nebraska has a lot of opportunities, enrichment opportunities, and a lot of social activities for individuals that are blind, visually impaired, and deafblind. You can reach them at Outlook ne.org. I hope that you'll go to their website and check out their enrichment opportunities.
Thanks, Nancy. Ashley?
This is Ashley, and I work for the Commission for the Deaf and Hard of Hearing. I work with deaf and hard of hearing people in the state of Nebraska. We do provide advocacy services, different programs that we offer to making sure that they have equal communication access. We work with different entities in the community as well. The only thing I have or event that's going on that I'm aware of is the Deaf and Hard of Hearing social event with with the Omaha Association, the softball that's happening on June 2nd.
Okay, thanks, Ashley. Online, start with Jim.
And my name's Jim Clements. I'm, well, 2 meetings into the commission. So just kind of how I got involved with this group. I'm the child of 2 deaf parents and one who's lost his vision due to degenerative retinal disorder. And then I'm an uncle of a niece who's nonverbal autistic. And so I just got connected to this group through those experiences. And then I also currently work at a nonprofit that actually does some, I would essentially call it kind of like a nonprofit construction company that does work in the affordable housing space, primarily, developing some housing and then doing some home repairs and modifications for both like seniors and then soon to be the immigrant and refugee communities. So my involvement here is kind of through those, personal connections, and then adding kind of whatever experience and help I can to the group through some other nonprofit kind of governance experience.
And how about Nat?
Hi, I'm with Dotted Eye Writing, my company, and I write grants for several nonprofits. And I was on the commission for 3 years as the secretary, and I just started back. My last meeting was our previous meeting, and it sounds like I may be doing secretarial duties again.
We'll at least talk about it, Natalie.
I am a mental health advocate, have some of that in my family and friends, and have done some work in that area. So that's what made me passionate about getting on the commission. My friend Wendy Hamilton originally got me involved, and Cliff McAvoy.
Great. A former chair, Wendy Hamilton. Andre?
Hello, my name is Andre Partridge. I'm a recent graduate from the University of Nebraska Omaha. I'm also autistic myself, and I'm here as a representative for all autistic people within the city of Omaha for the commission. I was brought in about a couple of years ago, about a year ago, around last winter, or was it 2 winters ago? Yeah, it was about a year or 2 ago that I was brought into the commission, and I'm here to actually advocate for, again, autistic people around the Omaha Heartland area. And also want to let everybody want to remind people that today, this month was Autism Awareness Month, as well as April 2nd was Autism Awareness Day. So for those who don't know, now you know, and glad to be here.
Thanks, Andre. And Daryl?
Yeah, I'm Daryl Kachera, and founder of a program out here in northern Nebraska for individuals that have MS, certainly like I do, Parkinson's, blind, hearing impaired, dementia, stroke. And it's a facility we're partnering with Creighton, Clarkson, UNO, UNL, College of St. Mary's, and soon to be Methodist, develop not only exercise, but also emotional support, caregiver support programs for people that are going through those challenges. So I, like Jim, this is number 2 for me. And we have about 100 and some people that are going through both the online and in-gym programs here.
Thanks, Daryl.
Where are you out of?
We are, you mean geographically?
Yes.
We are a baseball throw to the west of the Millard Airport.
Okay.
Okay. You're welcome.
I can't throw a baseball very far, Daryl. I just need to let you know
Yeah.
that.
When we were all in our prime, it was a baseball throwaway, that's for sure.
I'll take that. I want to thank our sign interpreter, Jay, for her assistance. Also, Cox Communication for taping and broadcasting. Again, we're on channel 22 on Cox Cable, and then we're also on the mayor's website in terms of rebroadcast or an opportunity to go back and look at information you might want to double check. Our next meeting is on May 22nd, and I think we're going to be continuing our discussion on homelessness. But until then, we're adjourned. Thank you, everybody.